by Graham, who asked a question about modeling again. Definition: modeling is the science of predicting or projecting disease trends or patterns based on a given set of data. And remember, initially when we were doing these projections, we were basing our data on events outside the country, maybe from China, Europe. Now that we have done more than 3 months with the disease, we are using more and more of our data to assist us in our modeling. And you have seen with the time that what we tell you here vis-a-vis what we project, there's no much variation. And the data that we are currently using, amongst other things, include the characteristics of the patients who get the disease, e.g. whether they are symptomatic, asymptomatic, how many persons can you be able to pass the disease to in case you are infected, also known as the R0, and how basically you apply the containment measures that we have put in place, including how you use your masks, how you do the hand washing, and maintaining physical and social distancing. So we can confidently state that going forward, we are having more locally generated information, which we are using to be able to model, and which reflects the reality of the Kenyan situation instead of what used to happen when we used to base our modeling on data from China and other places. And going forward, that simply tells you that things are falling into place as projected. You remember some time back we told you that going forward, later June, July, it will not be unusual to see more than 200 cases reported on a daily basis, and I think that is what is obtaining as of today. For the students who came from Sudan, yes, of course there is what we call patient confidentiality. These are cases that we have reported from Mombasa, but we didn't disclose that these people actually came from Sudan, but they are captured in our line list. Testing for COVID, yes, as Waziri said, is a good practice based on the clinical judgment of the clinician and also circumstances regarding the death of the diseased person. It is better to err and test even posthumously and protect the immediate family members and the rest of the society or community rather than leave it to chance, and then people fail to take appropriate infection prevention control measures that then will be able to expose a larger proportion of the population. The conditions, yes, predominantly those who die, majority of our patients have more than 2 conditions. And usually we have more than 2 existing conditions, majority being with diabetes and hypertension. That is the highest risk factor for COVID mortality, followed by diabetes alone, then hypertension, then other conditions including cancer. So that is why Waziri was emphasizing the need for those with coexisting conditions to continue visiting the health facilities for filling of their prescriptions, for assessment, so that we ensure that their control is good. We had a presentation today and something came out very interestingly, that for those who are HIV positive, the risk of COVID death is minimal. And we presume this is because most of our people who are on ART, antiretroviral therapy, are adhering to the treatment and therefore achieving viral suppression, and therefore their immune system is as good as those who are not HIV infected. And we want to applaud them for that, and also appeal to those who have other existing conditions like diabetes and hypertension, that adherence alone to the prescribed medicines will make your exposure much reduced, and therefore risk of death, even if you were to get COVID-19, significantly reduced. So the issue of stigma, yes, is a big problem, more so especially with the containment measures that are in place, because stigma will lead to further isolation, and with isolation, and that will lead to either anxiety or depression. Yesterday we engaged Kenyans under the Ask the DG platform, and our main focus was mental health. And what we need to do as Kenyans is to, 1, demystify the myths and misconceptions regarding COVID-19 so that we could get the correct information. Number two, we must develop coping mechanisms, that even if I'm diagnosed as COVID-19, I must have my coping mechanism, either from my close family members or close friends. They need to verify where you get your information. Either you get information from a verified source like Ministry of Health, WHO, CDC. Also, don't listen too much to the information that makes you unhappy. So if you think CNN is airing too much of COVID deaths, please switch off, flick off to another channel. So those are some of the measures that you need to put in place to ensure that you can be able to overcome this stigma. But we are working together with the counties to ensure that we scale down mental health services to the lowest level possible through the community health volunteers, so that they become the first aiders for mental health, so that they can be able to support those who test COVID positive. This does not require any unique training. In all of us who are here, we can quickly be sensitized on mental health, first aid, so that we can be able to support the rest of our families and friends. I think the issue of the thermogans was adequately addressed by Waziri, but that notwithstanding, Kenya Bureau of Standards, which is the body authorized to ensure that the standards are met, is of course on the lookout for anything in the market that does not meet the required standards, and they'll be able to take appropriate action. Remember also, because we are dealing with a pandemic, there are very many people who will come with all sorts of goods and services to be able to peddle around. So it is important that we have an oversight in terms of the machines and equipment that we use, that they are properly calibrated and they reflect the correct position, because any misjudgment using those tools could lead to a disaster. Thank you.